Hey there, health warriors! Bed rails are meant to keep patients safe, but when used incorrectly, they can become a serious hazard. Today we're talking about bed rails and entrapment zones, what they are, how entrapment happens, and how you, as a healthcare professional, can protect your patients while ensuring compliance and safety. Let's break it down. Bed rails, also called side rails or safety rails, are attachments used on hospital or long-term care beds to prevent falls or unintentional rolling, assist with turning or repositioning, and provide a sense of security for some patients. But while bed rails can be helpful, they must be used correctly. Improper use can lead to entrapment, injury, or even death. Entrapment occurs when a patient's head, neck, chest, or limbs become trapped in openings around or between the bed rails, mattress, or bed frame. Entrapment can result in skin tears or bruises, breathing restriction, strangulation, or even death, especially in frail or confused patients. Entrapment is most dangerous for older adults, patients with dementia, small, frail, or restless individuals, and patients with reduced mobility or confusion. The 7 entrapment zones, as defined by the FDA, are crucial to understand for ensuring patient safety. First, Zone 1 is within the rail, specifically between the rail bars. Second, Zone 2 is under the rail, found between the rail bottom and the mattress. Third, Zone 3 is between the rail and the mattress, often referred to as the side gap. Fourth, Zone 4 is between the rail end and the bed frame, either at the head or foot of the rail. Fifth, Zone 5 is between split bed rails. Sixth, Zone 6 is between the end of the rail and the mattress end. And finally, Zone 7 is between the headboard or footboard and the mattress. Each of these zones can pose different risks, so routine safety checks are absolutely critical. Best practices for bed rail use are essential for patient safety. First, use bed rails only when clinically necessary. Make sure to document the reason for use, such as fall prevention or mobility assistance. And of course, ensure informed consent when required. Conducting routine safety checks is another key practice. Check for gaps between the rails and the mattress. Ensure that the rails are locked and secure. If needed, use mattress extenders, padding, or gap protectors. Also, consider alternatives first. Low beds, fall mats, bed alarms, or close monitoring may be safer options. Remember, bed rails should not be used as a restraint unless ordered and documented. Monitor high-risk patients closely. For patients with confusion or agitation, side rails may increase injury risk. Reassess daily and involve the care team in decision-making. Educate staff and families. Ensure all team members know how to assess bed safety. Families should understand risks and benefits before requesting rails. When bed rails become a restraint, if a patient cannot lower or remove the rail on their own, it may be classified as a restraint, which has legal and ethical implications. In these cases, a physician's order and frequent reassessment are required. Document every use, justification, and alternative considered. Safety and dignity go hand in hand. Bed rails can be a valuable safety tool, but only when used correctly. By understanding entrapment zones, assessing patient needs, and staying alert, we can protect lives and uphold the highest standards of care. Does your facility conduct regular bed safety audits? Drop a comment with your best practices or challenges. Let's learn from each other. Like this video? Give it a thumbs up. Subscribe for more patient safety education, nursing tips, and healthcare training. And remember, use rails safely, prevent entrapment, protect every patient.